compared to LPS plication in cases of mild to moderate ptosis. Ptosis is an abnormal low-lying upper lid margin in primary gaze. There are many classifications of ptosis. It is mainly graded into mild, moderate, and severe according to marginal reflex distance 1 or MRD1. It is the distance between the corneal reflex and the upper lid margin in primary gaze. Although there are multiple non-surgical and surgical modalities for the treatment of ptosis, our study hypothesis was to evaluate Muller's muscle conjunctival resection, which is more predominantly used for the treatment of mild ptosis, as compared to levator plication, which is more widely used for the treatment of moderate ptosis in terms of their functionality and cosmesis for the management of both mild and moderate ptosis. In our review of literature, we saw the following studies which concluded MMCR to be equally efficacious as external levator resection or advancement in mild to moderate ptosis cases. Additionally, Sweeney et al. Concluded that MMCR has superior results compared to ELR when phenylephrine test was positive. Nesse-Arsenal et al. Concluded that MMCR group had lesser rate of complication and duration of surgery. Our aims of objective was to compare MMCR to levator plication in terms of our efficacy and cosmetic results in cases where phenylephrine test was positive because there was a paucity of prospective studies for the same. Ours was a prospective comparative randomized interventional study. We had taken 20 patients of mild to moderate ptosis, unilateral with good LPS action and phenylephrine test positive in consenting patients more than 4 years of age. 20 such cases were taken and randomized into 2 groups. We had done their preoperative evaluation followed by surgery. Postoperatively, they were followed up on 3rd day, 10th day, at the end of 1st month and 3rd month. In preoperative evaluation, we had taken their history, general examination with ocular examination, finally ptosis workup, after which the patient underwent either MMCR or levator plication. In post-operative assessment, we had graded them according to 3 criteria: the marginal reflex distance 1, objective assessment of cosmesis based on MRD1, and subjective assessment based on patient satisfaction scale. In results, we saw the mean age of presentation was 18.15 years, male is to female ratio was 1.22, right eye and moderate ptosis were more often operated than their counterparts. In levator plication group, the baseline preoperative MRD1 was 1.5, which improved to 3.7 after 3 months. And in the MMCR group was 1.3 mm, which improved to 3.8 after 3 months. The p-value was insignificant. The 3rd month MRD1 following surgery had statistically insignificant p-value. The objective assessment had 100% good grade, and the subgroup analysis showed the same with insignificant p-value. In subjective satisfaction, also had insignificant p-value. This was a case of MMCR. Post-operatively, the MRD1 improved with no surgical scar. This was a case of levator plication. Post-operatively, after day 10, we saw improvement in MRD1 with a surgical scar. Therefore, to summarize, there is no statistical difference in MRD1 objective assessment or subjective satisfaction in a study between both groups. We also saw no ocular or cosmetic complications in both groups after 3 months. We conclude MMCR is a safe and effective modality as compared to levator plication in cases of mild to moderate ptosis with phenylephrine test positive, and recommend it for such cases because MMCR is a transconjunctival procedure and leaves no scar as compared to levator plication, which is an external procedure and will leave a scar. Thank you.
Thank you, Dr. Biswas. So all your cases were phenylephrine positive?
Yes, ma'am.
And you didn't grade like mild and moderate, it was just mixed?
Yes, ma'am.
It was randomized?
It was randomized. All were phenylephrine positive, and then we randomized into 2 groups.
So do you feel 3 months is enough to assess the efficacy of the procedures?
Yes, ma'am. That is one of our drawbacks of our study. We had recommended a larger sample size with a longer follow-up for better assessment of this between the surgeries.
And did any of the cases need any secondary intervention?
Up until 3 months, there was no need of a secondary intervention.
Just a suggestion, for the larger screen it was okay, but for the screen, the font size should be at least minimum 24. We had a tough time reading few of your papers.
Okay, so yes, ma'am. Thank you. I will note it next time.
Okay, from my side, like Muller muscle resection or conjunctival muscle resection is effective most of the time only for mild cases of ptosis. Okay, so you can't compare like mild to moderate, like both the entities you can't include in your study group. Either you can include the mild type of ptosis or moderate. Okay, for the moderate and severe, the plication or resection is more effective.
Ma'am, we had done subgroup
So this is
analysis for
a
the same.
limitation of your study. So you should have included like
No, she's done it.
Ma'am,
Tell.
we have done subgroup analysis for the same.
What is the analysis in the moderate?
Ma'am, in the moderate group also, in objective assessment, it is 100% good grade in MMCR, and in also in subjective satisfaction for MMCR group, we had seen 50% had fair grade and 50% had good grade.
And what was the maximum amount of ptosis that you used in your study?
Ma'am, moderate 3 mm.
Okay, thank you, doctor.